Hello, my name is Kevin Hatton. I'd like to talk to you about a research study currently underway at the University of Kentucky. The study is called the Hyperbaric Oxygen Brain Injury Treatment Trial, or HOBIT for short. As you may know, traumatic brain injury, sometimes shortened to just TBI, is one of the most common causes of acquired brain damage and permanent disability in adults. Sadly, there are no effective treatments to prevent or reverse brain damage caused by TBI. But we are hoping to change that. Preliminary research indicates that delivering very high levels of oxygen to the brain early after TBI improves the brain's ability to recover. Because of these findings, HOBIT, a multi-center study funded by the federal government, is currently recruiting patients with severe TBI from many different hospitals across the country. HOBIT is primarily designed to evaluate brain recovery using a hyperbaric chamber to get the very high levels of oxygen to the brain. Hyperbaric chambers, like the ones used in HOBIT, are already used at UK to treat patients with chronic non-healing wounds. This chamber has clear glass walls, allowing patients to be closely monitored by the doctors, nurses, and other therapists during their treatments. To participate in HOBIT, patients with severe TBI must be enrolled shortly after arrival to our hospital. The effectiveness of the oxygen treatments is highly dependent on using them very early after the brain has been injured. Patients in the study will receive oxygen treatments twice daily for 5 days and will receive normal, standard care the rest of the time. Patients will then be followed for up to 6 months to monitor their brain recovery. Although this study is very promising, for several reasons it has been difficult to enroll potential patients. First, patients with this type of very severe TBI are not conscious and cannot agree to the study themselves. Second, we frequently cannot find family members to agree to the study in the short window of time needed to start treatments. Therefore, to increase enrollment in this study, we are considering the use of a consent process called EFIC. EFIC stands for Exclusion from Informed Consent. When EFIC is used, a patient can be enrolled in the study without his or her consent. However, if the patient is enrolled, the patient or a family member can withdraw the patient's consent at any time. All patients, regardless of whether they are enrolled in the study or not, will receive the normal standard care treatments for TBI. We want your opinion on the use of EFIC for HOBIT in patients within our community. Please complete the short survey using the provided link to tell us what you think about HOBIT and the use of EFIC for this study.